Hello, everyone, and welcome to another City of Lubbock COVID-19 news conference. My name is Matt Dotre. I'm sitting in for Lacey Nobles. Today's press conference will feature a panel of healthcare professionals to offer their perspectives on the continued spread of COVID-19 in the area, followed by media questions. Joining us on our panel is Public Health Authority Dr. Ron Cook, Medical Director of Emergency Medicine at UMC, Dr. Christopher Peel, Chief Medical Officer at Covenant Children's Hospital, Dr. David Gray, and board certified OBGYN and rural physician in Denver City, Dr. Scott Frankfather. All right, Dr. Cook, we'll start with you.
Thank you so much, Matt. Let me first off and say thank you for everybody for all you're doing for our community, trying to keep us safe and trying to keep our healthy ones from getting sick. And let me also say thanks to our healthcare providers. I know you're tired, but thank you for doing the yeoman's work and staying strong and taking care of our community. Let me talk to the community now. If you're sick, please stay home. We don't want you infecting anybody else. If you're also sick, please get tested. Don't return to work until you know that your test results are negative. This Delta variant is so very infectious. It's twice as infective as the previous one. So one person not only infects 4 like the first strain, but now that one person can infect 8 people at a time. So, and if you haven't received your vaccine, please go get your vaccine. I'll tell you more about that in just a moment. You know, last night you can look on our the health department's webpage, and our numbers remain very high in the community. Our hospitals are full, our ICUs are very full. And you'll hear about some of the struggles that we're having in the emergency room with our guests and having trouble getting our rural communities, getting those patients transferred to our tertiary care centers, such as the hospitals here in Lubbock. So we're full. And they're full of mainly patients that haven't been vaccinated. These vaccines are very safe. We have 198 patients that are in the hospital related to COVID. We have 54 of those in the ICU, and none of those in the ICU, what I'm trying to say is here, if you've been vaccinated, you're not going to end up in the ICU for the most part. There are 16 of those patients of the 198 that have been vaccinated. That's what we call a breakthrough case. That's about 8%. So if you've been vaccinated, about 8% may come down with the COVID virus. You're more than likely not going to have to be admitted to the hospital and certainly not going to be admitted to the ICU. 8% is about what we're seeing, not only in our community, but in the state and also in the surrounding states. These vaccines are very, very good at preventing disease and serious disease, even hospitalizations. And so, but we need people to continue to get vaccinated. The average age of the individual that's in the hospital is 55 years old. This is the group that's only about 60% vaccinated with only 1 dose. And we really need you to get both doses of the mRNA vaccine, or at least 1 dose of the Johnson & Johnson vaccine. The average age of the ventilated patient in the ICU is 47. That's a very young patient population to be on ventilators. And the average age of our pediatric patients is around 10. So this is a disease that is almost completely stopped by vaccine. It's not a perfect vaccine, but it's very, very good and very effective at preventing disease. 99% of all the COVID infections in our community are the Delta variant. And this Delta variant is a very bad player. It's, like I said, 2 times more infectious than the Alpha variant or the very first variant. It's much more aggressive, causes disease faster, and infects many more people at once. We're seeing entire households infected within days of each other. And many of those patients, many of those members of the household may have to go to the hospital, and many people, and we're seeing many households that have lost multiple family members just within days of each other. That's such a tragic situation, and it can be avoided by getting the vaccine. Right now, if you're older than the age, if you're 12 and older, you can get the vaccine. There's plenty of opportunities to get the vaccine. I'll go over those in just a minute, but right now, if you're 12 and older, you can get the vaccine. I suspect that sometime in the fall, in the near future in the fall, that they'll lower that to 6 and 12, 6 and 11. So I think that that's coming. I think that that's good news. So look toward that as well. Because we can't vaccinate our children under the age of 12, let me strongly encourage you, for everybody, not just children, but everybody, to continue to wear masks if you're in the group setting. And this includes, as health authority, for the safety of the community, let me encourage you to wear, or your children to wear masks to school. That's my point of view, and that's my opinion. If I had a child that was under the age of 12, I would ask them to wear a mask in school. Let's talk a little bit about the vaccines. The vaccines remain very effective. 95% against the alpha strain, 88% effective against the Delta variant. And we have lots of vaccine to go around. Look at our website, on the health department's website, for clinic times and clinic locations. Good news is, if you go shopping at the mall, we have a vaccine clinic set up in one of the storefronts in the mall. It's open from Thursday to Sunday, from noon to close. So it's going to be there a while. So make sure that if you're out in the mall, you can go over there and get your vaccine. The other thing that you can do is go to vaccines.gov. That's vaccines.gov. You put in your zip code and it will tell you every place around you where you can get the vaccine. That's an easy thing to do, vaccines.gov, and put in your zip code. If you're sick with COVID, you may be eligible for the antibody infusion. This antibody infusion helps keep a significant number of ill people out of the hospital. We are continuing that at the Grace Hospital that's on 50th and University. Please talk to your primary care provider that if you're sick, you may be eligible to receive this antibody infusion and stay out of the hospital. So talk to your primary care provider. Lastly, I'm going to say, you've heard me say it hundreds of times, please wash your hands, wear a mask, continue to practice social distancing when possible, and don't go to work if you're sick. Let me hand this off to Dr. Peel, who is the medical director for University Medical Center's Emergency Department. Dr. Peel.
Yes, thank you, Dr. Cook, for the opportunity, and I'm glad to be able to speak on behalf of the staff here in the Emergency Center. It's been a long 18 months, as you can imagine. You know, I think everyone knows the struggles we faced in 2020 around March, spring break of that year. The numbers of infected people started to rise. We had a little bit of break early fall, but really got hit hard last winter. And our staff, you know, in the hospital and in healthcare in Lubbock really stepped up to the plate. And it was a dangerous time then. We didn't have a vaccine. So people were dependent on protective equipment and were unsure of whether, you know, we were going to become infected and potentially succumb to the virus. Fortunately, we were vaccinated late in the year. That vaccine was available, and it was certainly a blessing to us. No doubt all the physician staff here in the emergency center were vaccinated. Most of the nursing staff were as well. And so we weathered that storm. We went into 2021 this year with a better outlook. We saw the number of cases decline, but the Delta variant has really changed the game. And for the last 8 weeks, it's been very difficult and troubling in the emergency center, as you can imagine. You said it well, the people we see are unvaccinated. Right now at UMC, roughly 100 people are in the hospital and 95% of those are unvaccinated. So imagine if everyone was vaccinated in the county right now, even with this Delta variant, which is very dangerous, we would have roughly 10 patients in the hospital and none of them would be in the intensive care unit. We see people, and it's difficult to take care of 30-year-olds, 40-year-olds, 50, 60-year-olds who are otherwise fairly healthy. And they come in afflicted with this virus and end up coming in the hospital, and some of them don't survive. I learned of 2 patients this morning that I've cared for in the last couple of weeks who who have died, and these are people who would otherwise would be here today. And so the staff they're tired, they're fatigued. I mean, we're here to help people. There is some level of frustration. Dr. Cook mentioned it well. We're the referral center for the region here at UMC and Covenant as well. And we want to be available for our fellow citizens in the South Plains. I mean, if someone is ill in a small town around here, we want to be able to afford them the care they need should they need to come to Lubbock. And right now, the ICUs are full and the hospital's full and the ER is full. We're holding admitted patients in the ER because we have nowhere else to put them. And so when you come in with something that's not truly an emergent thing, you're going to end up waiting a prolonged time. And that's frustrating to us because that's not what we're designed to do. We're here to take care of people and try to do that very efficiently. So, you know, I'm a physician now, but I'm a small town boy and I grew up in West Texas, and I would never lead anyone astray, but the vaccine is effective. And from what I see here in the emergency room, the people that come in who are vaccinated just aren't that sick and rarely need hospitalization. So I certainly encourage everyone, as Dr. Cook mentioned, to get that vaccine. I'm actually looking forward to maybe the recommendations coming back down where I'll get a booster vaccine because I want to be safe and be there to take care of people as the year progresses. And with that, I think I'll pass it either back to Dr. Cook or Dr. Gray, I believe.
Thank you, Dr. Peel. I want to give a pediatric perspective on the Delta variant, which is behaving differently from the previous variants we have seen during the COVID pandemic. We are seeing more kids in the pediatric hospital than we did with previous variants. We're also seeing sicker kids with the Delta variant. We have 4 kids in our 18-bed PICU, which are intubated, and we've never had that many COVID patients in the PICU who are intubated. There is also a procedure that we call ECMO, ECMO, which is a type of lung bypass. We have provided 22 straight days of ECMO services to 4 different patients, and that is also unprecedented. The youngest patients that we have placed on ECMO have been 16 years and 19 years of age. Very unusual and attributed directly to the Delta variant. We are attempting to expand our COVID capacity in the PICU by retrofitting certain rooms to handle that type of patient, because we're getting calls from other children's hospitals who are looking for PICU capacity. The underlying risk factors for kiddos are similar to those in adults. You tend to have a much more severe course if they have something like diabetes, hypertension, or obesity. The vaccine that has been mentioned several times is increasing in popularity among kiddos, and we would like for those 12 years and older to be vigilant about becoming vaccinated. There have been several vaccine drives organized, and those also remain available through the health department at the mall and other places. So I would encourage folks to investigate that for kids. As far as the younger kiddos go, we hope to have availability of vaccines perhaps as early as October. Difficult to know for sure, but that's our hope. Then we'll try to get those vaccines in the pipeline as quickly as possible. An interesting thing about the Delta variant is its the presence of RSV. RSV is a virus that we see every single winter, very, very predictable. It's not a matter of if, it's simply a matter of when RSV is going to present, except this past winter, because of the efforts that were made directed toward COVID, including masking and social distancing and hand hygiene. We really didn't have an RSV winter season, just like we didn't have a flu season this past winter. Well, beginning at the end of June through July and through August, we have had a significant number of RSV cases, which is unprecedented. Many of those kids have been very ill. We're accustomed to seeing very ill children with RSV, but not during the summer. The challenge with increased COVID numbers and increased RSV numbers is finding the staff to man the available beds. We have lots of beds. We just need additional staff to take care of the kids in those beds. So we have had to be very careful about our admitting volume. And we're seeing some of the problems that other children's hospitals are experiencing with a shortage of staff. Our ER volumes have been rising in the pediatric hospital. During the early months of COVID, ER volumes dropped dramatically. But beginning in August, our volumes have come back significantly. And we're now at levels that were seen prior to the presentation of COVID. So that also adds an additional challenge to our staffing. We're accustomed to increased staffing during the winter. Summer increased staff provides a special challenge for us. All of that discussion about the past, looking at the RSV and flu season from the winter of 2020, causes us to look ahead. If we are not diligent about masking and social distancing and good hand hygiene like we were in the last winter, this coming winter, we would expect to be inundated with RSV, flu, and COVID in kids. And that will present a significant strain to our capacity here in the South Plains. We have received patients from several surrounding states because their capacity has been used up. And we will not be able to take care of our own kids, much less accept transfers from other geographic regions, unless we remain diligent with the social distancing, masking, and good hygiene, as well as you've heard already, taking advantage of the vaccination whenever possible. Those conclude my comments for now, and I'll pass this on to Dr. Frankfarther.
Hello, I'm Scott Frankfather. I'm a board-certified obstetrician and gynecologist in Denver City, a rural community about 75 miles southwest of Lubbock. I've been in Denver City 12 years. I deliver about 250 to 280 babies a year here in Denver City, and I see about 100 patients in the clinic weekly. We've had a huge increase in our number of COVID patients. We're a small rural hospital. We're called a critical access hospital. We have 24 beds. Currently, we have 9 of those beds occupied by COVID patients, and many of those patients are severely ill with COVID. Over the month of August, we've had 21 patients admitted. Several of those patients have had to be transferred to other facilities. Dr. Cook asked me to speak about some of the challenges that we face in a rural setting. And as several of people have alluded, beds are full at tertiary care facilities. Tertiary care centers are University Medical Center, Covenant, the bigger hospitals with specialized care, ICU care, doctors that specialize in ICU care. We're a very small hospital with no ICU capability here. And prior to COVID, we had no ventilators. We now have 4 ventilators, and at one point we had 3 patients on ventilators. We've had, in the past month, we've tested 914 patients, and we've had 327 positive COVID patients. 21 patients were admitted, and of the patients that were admitted to the hospital, only 1 patient out of 21 had received the vaccine. That patient had underlying medical conditions, and he was 89 years old. So I think that speaks volumes for the effectiveness of the vaccine. And I encourage patients to, if they're able to get vaccinated, if they're over the age of 12, I encourage parents to vaccinate their children. I'm an OB-GYN, and I can tell you that I've had a lot of my OB patients have received vaccinations with no ill effects. As a matter of fact, we've vaccinated in Denver City. We vaccinated 1,168 patients up until today. And of those patients, we've had no patients that have had to be admitted to the hospital. So I really feel like that the vaccine is safe. I feel like it's safe in pregnancy. The American College of OB-GYN, American Academy of Pediatrics, all say that the vaccine is safe in children and in pregnancy. The vaccine is also safe in breastfeeding. Some of the other challenges that we have faced here in our rural community is one of the big challenges is not being able to transfer patients because of the larger hospitals being full. We've had to transfer patients to distant locations. I had to transfer one COVID patient to Tomball, Texas, Dallas, Amarillo, El Paso, Albuquerque, San Antonio, and that presents a logistic problem, both with transportation. Many of these patients are on high levels of oxygen, and these air ambulances can't carry enough oxygen to transport the patients for great distances. And we have to work with fixed wing air ambulances, which means the air ambulances have to come in a jet or a large airplane, and that presents a problem, not being able to carry enough oxygen to transport these patients. Our local EMS is understaffed and they're unable to transport patients. A lot of times we've had to get air ambulances to transport these patients even to Lubbock or Amarillo, because in Midland, Odessa, we've had to transport to all of those places, and those places our EMS is unable to transport because they don't have enough staff to staff our 911 service and to transport patients for several hours. So that's been a real challenge. We've also had, as the other doctors alluded, they've had nursing shortages, staffing shortages. We've also had that here. We've had to have staffing agency nurses that come in and help pick up our slack and help take care of the patients here in the hospital, where we've never had that happen before. Normally we only have 5 nurses on a shift. And when you have 9 COVID patients, and some of those patients are 1 nurse to 2 patients or 1 nurse to 3 patients, it makes it really difficult, and it puts a lot of strain and stress on our nursing staffing. Some of the things that we've also noticed is transferring these patients to other facilities. We have to call multiple times. We have a central system. It's called EM Resource. EM Resource allows us to call and find bed availability at multiple hospitals, but it doesn't seem to be updated frequently. And we're having to call back or check that EM Resource multiple times for bed availability. That has been a very time intensive, and it has been very difficult for our staff on both ends, the staff here and the staff in receiving hospitals. It's difficult and time consuming, just trying to get patients to the proper care that they need. We've had about 238 patients that are some of the things that we're doing to help encouraging vaccination. Again, I can't emphasize enough how important it is to get vaccinated. 1 out of 21 patients at our hospital had to be admitted with COVID after having a vaccine. 21 patients, 20 patients were unvaccinated. Several of those patients went on to die. And I just can't strongly encourage enough to, if you can get vaccinated, we have a vaccination clinic here in Denver City every Wednesday from 1 to 6, and our specialty clinic, and they're doing that to minimize waste of the vaccine. But if that gets full, we'll expand our vaccination clinic and try to accommodate people at other times. The other things that we have seen that has really helped us keep people out of the hospital. We've had a remdesivir outpatient clinic, which is the antiviral medication. It's similar to Tamiflu, and it decreases or it interferes with viral replication, which is really good in the first phase of infection. Once patients get past that viral replication and get into the inflammatory phase, remdesivir really doesn't seem to help much. But in the early stages of the disease, remdesivir really does help. And we've had 238 patients that we have treated in the month of August with remdesivir. Of those 238 patients, we've only had to admit 3 patients to the hospital. So I encourage patients to talk to their primary care provider, and I encourage them to seek early treatment if they start feeling ill. If you start having a high fever, shortness of breath, difficulty breathing, fever, chills, and body aches, those are not low fever, chills, and body aches are not really worrisome. Stay active, take vitamin C, vitamin D, and zinc, and stay active, drink plenty of fluids and rest. Walk every day, get out and walk in the sunshine, walk every day. That seems to help keep people out of the hospital. Beyond that, if you start feeling ill, seek care quickly. There are things that we can do to help with steroids, with IV antiviral treatments, with, as was mentioned earlier by one of the other physicians, using monoclonal antibodies that are manufactured specifically to fight against COVID. Those antibodies are effective, but what's even more effective than that is the vaccine. Please, if you're able to get vaccinated, I'm like Dr. Peel said, he's from a small town in West Texas. I grew up here. In Denver City, and I've had to watch my friends and family die here in Denver City, and they're dying unnecessarily. Several of these patients have died before vaccines were available, but I've had to watch several people die since the vaccines have been available that should still be alive today. Young people. Had a 46-year-old that died just recently. These are young people that should be alive today. And I pray that people will seek early care and, better yet, get vaccinated. And with that, I'm going to turn this back over to Dr. Cook.
Thank you, Dr. Frankfather. Thank you for everybody that helped, Dr. Gray, Dr. Peel. I think it's going to be Mr. Mascio, Mayor Pro Tem.
I'm just here for the Q&A. I think we're going to go ahead and move into the Q&A portion.
Okay, great.
Very good. Yes. All right. Thank you to all of our panelists. If everyone will please turn their videos back on. And yes, Mayor Pro Tem Mascio is going to join us for questions as well. For the sake of time, media friends, we're probably going to limit it to one question, if that's okay. And today's order is Sarah Self-Walbrick with Texas Tech Public Media, Karen McKay with KCBD, Chrissy Martinez Garcia with Latino Lubbock, Katie Gray with KMAC, Erica Pauda with KOBK, Toluani Osibamoa with the DT, Olga Aguero with El Editor, and Gabe Monty with the AJ. So we will start with Sarah with Texas Tech Public Media.
Hi, everyone. I appreciate each of you being here today and sharing what you're seeing. I know a ton of people who had a COVID-19 exposure last week and needed to figure out testing. What does COVID testing access look like in our community right now? And when should people get tested, particularly people who are vaccinated?
I'll start with that, and then I'll kick it to Dr. Cook. The city's currently conducting testing at Clapp Park. It's 46th and Avenue U. You can access the times on the city website if you look for the COVID data page, but we're testing lots of people, and we're trying to make testing available to anyone who may have a concern.
So Sarah, you ask a good question. When should you get tested? One, if you're symptomatic, if you've been exposed, please. And it's a pretty aggressive virus. If you've been exposed, we say 3 to 5 days after exposure. Certainly, if you know that you're a close contact and from an exposed person, say a family member or somebody else, let me recommend that you put a mask on. You could still go to work, but you should be wearing a mask just in case that virus is replicating in you and you don't want to give it to anybody else. So please, it's not only in that particular situation, it's protecting your friend and colleagues.
Thank you, Sarah. Okay, next we'll go to Karen McKay with KCBD. Can you hear us, Karen? Okay, we'll come back to Ms. McKay. Next, we'll go to Christy Martinez Garcia with Latino Lubbock.
Did we just lose Christy? Oh, I see her.
Okay, y'all did a little something different there. Good afternoon, everybody.
Good afternoon.
Dr. Cook, Dr. Pill, Dr. Gray, Dr. Frankfather, thank you so much for being here. We continue to hear about the stress, the frustration. You've all talked about finding staff being overworked, the dangers to staff, and you keep making pleas to the public. But what demands are you making to officials, starting with local government to state government? Because people, you know, they appreciate pizza parties, they appreciate having the meals delivered, but the staff is telling me that they need some advocacy. So what demands are you making to these local and state officials to correct this issue?
You know, Christy, that's another good point. We know the science, and we try to impress upon our people. You know, I know Mayor Pope, I know Mayor Pro Tem Massengill carries the same message. But we, you know, it's our goal to try to get people to make those changes. And right now, sometimes our hands are tied with governor's orders, et cetera, that say we cannot mandate those sorts of things. Even when common sense would say that you should do those sorts of things. We are doing our best, Christy. I wish I had a bigger stick sometimes. From a personal and science point of view, we know that masks work. We know that vaccines work. And I have to leave it to our city leaders to lean on Austin and lean on other individuals to try to make those decisions.
On that note, Mr. Massengill, it's important that we correct the abundance of misinformation or lack of access to information. And I know that the city has chosen to only use a dashboard for people to learn what numbers are. But the problem is that a lot of folks are not media savvy or tech savvy. And so they become dependent on family and friends who in turn give them misinformation. So I believe that the city needs to continue to be sharing numbers on a daily basis, because believe it or not, there's people that don't even know that we're dealing with the issue of COVID again. So we need to take a more proactive measure to connect and share information with the public. I appreciate any response that you might have to that, Mr. Massengill. Otherwise, thank you again, and God bless you all.
I'll be happy to respond to that, Christy. Yes, you're correct. There's lots of misinformation out there. People have to make their own decisions. To dovetail off what Dr. Cook says, the city is using all the tools it has to provide the things that keep people safe. People are going to have to make their own decisions. That's the difference between now and 12 months ago, is we have the tools to keep people safe. And I can't make someone decide, but all I can do is help provide the information and provide the tools for them to make that decision.
Then provide the information.
Thanks, Christy.
Christy, there is a billboard, I think it's on Marsha Sharp, a digital billboard that lists the daily numbers.
And I appreciate that, but we still need, everyone isn't going to drive by that one billboard. It is up to the city to do their appropriate work. I used to be a PIO for the city and I know how it works.
Thank you very much, Christy. Okay, next we're going to try Karen again, if Karen McKay with KCBD is available. You there, Karen?
Looks like she's muted.
Okay, we'll try again later. So next we will go to Katie Gray with KMAC.
Hello.
Yep, there we go.
Hi. Yes. Thank you so much. You're right. I do see that it's a little different than last time. Hi. Thank you so much for all of you being here. I really appreciate it. I think that my question is still kind of a follow-up a little bit to what you've already kind of discussed. The last time that we met and we had this discussion, the mayor was able to give us a little bit of an update of the state sending in a little bit more support, especially for nurses. I wanted to know if there is any other follow-up onto resources, equipment, even further staffing that's going to be accessible for our hospitals that we know of at this point.
Eddie, I can tell you what we know from the city's perspective. There's been just a handful of staff added this week. I'm not aware of any other resources at this time, but we stay in constant contact with the state to make sure that we take advantage of anything that's available to us, because we're all very aware of the stress of our healthcare workers right now. I don't know if you have anything to add to that, or anybody else in the presser.
I have access to those numbers. I apologize, Katie.
Thank you.
Thank you so much, Katie. Okay, next we're going to go to Erica Pauda with KLBK.
Hi, can y'all hear me now?
Yes.
Okay, all right. So I heard a story about a child with Lubbock ISD who was exposed to COVID and was told by their school to come back the very next day. There was no Chromebook sent with the child to self-isolate from home until they could get a negative or positive test. And as you know, certain age groups do not qualify for a vaccination. And furthermore, I know that TEA and the state have changed how school districts do not have to do contact tracing. And as a parent of a 7-year-old in the district, I want to know why Lubbock ISD isn't taking more initiative to list the amount of people in quarantine, because they have omitted that from their COVID dashboard. So it's kind of hard to tell exactly how many cases they're going to have coming.
Yeah, Erica, I can't speak to what's going on at LISD. I know that there is a significant challenge there. You know, again, parents, there's not a mask ban. I mean, if parents have the tools to keep their children safe and when they send them to school, I would contact the school district if you have further detailed questions about their dashboards.
Right, but you know, I know that all school districts are, you know, discussing things with the city health department and all of that. So, I mean, I know that, you know, everyone is fatigued and we're tired of COVID, but, you know, we're about to hit those surges again. And my concern is that this school district in particular is not being transparent.
Sure, I understand your point.
All right, thank you.
Thank you, Erica. Okay, next we're going to go to Toluwani Osibamoa with the Daily Toreador.
Good afternoon, everyone. Thank you so much to our medical professionals who are present and spoke today. As Dr. Cook mentioned, COVID cases are rising across Lubbock, and that also includes the tech community. Students are coming back, having face-to-face classes, and of course, not everybody is wearing masks. What do you say to the concerns of the Texas Tech students, faculty, and staff who are worried that this continuing rise in cases will require us to return to our online modality for classes?
Toluwani, that's a great question. And I know that we've had some conversations, and Student Health Services are working their fingers off, literally, and some other volunteers on the main campus are working very diligently on trying to do the contact tracing. It's my understanding it is their goal to continue to provide in-classroom education as best as possible. I know that the leaders over there on the main campus and the Health Sciences Center are keeping a very close eye on the number of cases that are present on the campus. They have contingency plans for individuals who become sick. And then also, the goal here is to encourage everybody, if you're going to be in a tight space in a classroom, it does not hurt you a bit to wear a mask. It's not going to dull your mental faculties. It's not going to do anything. It's just going to protect you and protect others. If you are asymptomatic, it's going to protect others, and it protects you from catching the virus. So the easiest thing to do is put a mask on and go to class and go to work, and especially if you're going to be around other people. Right now, this COVID variant, this Delta variant, is a very serious variant. And the easiest thing that you can do is wear a mask.
Very good. Thank you, Toluwani. And next we will go to Olga Aguero with El Editor.
Can y'all hear me?
Yes, ma'am.
Yes, ma'am.
All right. Buenas tardes a todos. And I think the panel this time around was very informative, and it's good to see other faces, especially beautiful faces that take care of our people in our communities. And with that being said, I think there was one thing that I would like for the doctors to answer. I think the question was asked, but there wasn't an answer. If you have been exposed to someone that has COVID, how many days should that person wait to get tested? Because what has happened, or what is happening, is once they know they were exposed, they get tested, comes out negative. But then down the line, a few more days, they get those symptoms, then they get tested, and then yes, they're positive. So how many days should a person wait to get tested after they have been exposed? And then another quick little, not another question, but real quickly, the reasons given for vaccines or not getting vaccines are outrageous. I mean, and I don't think I have to sit here and tell y'all probably have heard everything in the book. But as physicians, could you maybe share, if you know, some of the reasons that these patients are given that they did not take the vaccine, maybe those that are still hesitant and still listening to those reasons that these people didn't have vaccines, maybe they can, listen, and they'll change and get the vaccine. We need to do everything that we need to the highest power of our souls to get everybody vaccine. I have been working a lot through the paper, exposing this COVID, saying the importance of getting the shots. And through our churches, our Catholic churches, and a lot of other churches, they have been told every Sunday after, hearing the Mass, the beautiful Mass, is to go get vaccinated. So I think that's good, but we need to do more. But thank y'all for everything. God bless y'all.
I'd like to take the opportunity to answer your question, Olga. This is Dr. Frank Father. Can you hear me okay?
Yes, sir.
Yeah.
We can hear you.
Okay. I think the answer to your question, how long should you wait after being exposed? 3 to 5 days, or if you're symptomatic, that's when you should get tested. If you know, as Dr. Cook said earlier, if you know that you've been exposed, the best thing to do is to wear a mask, social distance, frequent hand washing, hand sanitizing, to try to decrease the spread of COVID. Also, as you were asking about, Olga, you were asking about stories regarding why people will not vaccinate. The biggest one that I heard for the longest time was, I'm not going to get that vaccine because it's not FDA approved.
Mhm.
Well, so that vaccine is now FDA approved. At least the Pfizer vaccine is now FDA approved. And I think that is one hurdle that people that are speaking out against vaccines now, they can't use that hurdle to stop people from getting vaccines. I don't really know why so many people are adamant about or speaking out adamantly against vaccinating. I think that we've vaccinated 1,168 people here in our hospital, and we have had not one person has been admitted following being vaccinated. We've had a couple of sore arms and a rash and, very small, minor side effects from the vaccine. We've had not one patient has been admitted to the hospital after being vaccinated out of 1,168 people. So, that's still a pretty small sample size. But the other things that I've heard, it coagulates the blood. It causes the blood to clot like people have cancer. That's absolute nonsense. There's been, as of a few days ago, over 340 million doses, over 171 million people have been vaccinated across the United States. And of those people that have been vaccinated, if it caused the blood to clot like people purport it does, that would, you would have people dropping like flies. People would be in the emergency room. People would be admitted to the hospitals with blood clots and strokes and heart attacks. And while we do see those things with COVID, and that's one thing to mention is a lot of people don't realize this. Patients with COVID infections have horrific laboratory values. I've never seen people with any other disease that have had blood clotting the way that patients that have COVID have blood clotting. So it's not the COVID vaccine that people need to worry about. It's getting a COVID infection that causes a huge amount of blood clotting and inflammation in the blood vessels, the arteries, that really put people at risk. And I encourage people to get vaccinated. Vaccinating pregnant patients, breastfeeding patients, it's absolutely safe to get the vaccine during pregnancy, during any trimester. And I appreciate your question.
Very good. Thank you very much. Okay, next we will go to Gabe Monty with the Lubbock AJ.
Hello, everyone. Thanks for having me. I just was going to ask about, recently there have been reports of poison control calls for people using certain livestock medication to, I guess, get ahead of COVID or treat it. Is that something that we're seeing here in Lubbock?
I don't know of any cases of overdose, or maybe Dr. Peel can speak up. I haven't talked to poison control. The regional poison control is for, it's a huge region that they answer to. So I don't know if anybody has showed up in our emergency room. I know people are taking it. There's not a lot of studies out there. There's some small studies that it might help maybe, but the studies, actually look back and look at data that's not really related to that drug or to the effect that we're trying to see. So there are studies going on to see if it works. There's other drugs too that they're looking at, but right now this drug is not approved at all, even under emergency use for this disease. So, Dr. Peel.
Yeah, I'll comment quickly, Ron. Thanks. I haven't seen an overdose here, but I do know in the emergency medicine literature, there is an increased call volume to our poison control centers for questions about potential overdoses. So please do not take it upon yourself to treat yourself with a livestock medication for COVID. Please put your trust in the healthcare providers, and we'll do what's right. And I'll echo what Scott said, Dr. Frankfather said about the vaccine. Yes, we're not seeing reactions to the vaccine, and there is a lot of folklore out there. So yeah, I'm appreciative, Olga, for all you're doing to go out and spread the word to please get the vaccination. We don't see people coming in with reactions to the vaccine or getting admitted for any sort of reaction to the vaccine. Where the rubber meets the road is when you go to the family room to tell a 30-some-odd-year-old family member that we've now put their loved one on a ventilator, and that person may be ventilated for weeks and may not survive. That's the reality of COVID. The vaccination is safe, and the real protection to going out and resuming our lives is to really get everyone in our community and our region vaccinated so we can get back to normal. So.
Thank you, Gabe. Okay, we're going to circle back with Ms. McKay from KCBD. And if not, she emailed us her question. But Ms. McKay, are you there?
Still looks like she's muted. Why don't you go and read her question, Matt?
Okay, all right, excellent. If someone tests positive for COVID or knows they have been exposed, shouldn't they be encouraged to go straight to the infusion center to get monoclonal antibodies, since we know that is proven to reduce symptoms and keep people out of the hospital?
Okay, and Karen's unmuted now, by the way. So, Karen, can you hear us?
I can. Can you hear me?
Yeah, we can. Matt just read your question. Do you have anything to add to that, or if not, we'll kick it to the docs?
No, that's what a lot of people are asking me.
So Karen, to go to the infusion center, you need a physician's referral, and they have to fill out a form, and you have to meet certain criteria. Now, those certain criteria are fairly easy to meet. Do you have diabetes? Do you have a high risk? I won't go over them all, but other high risk complications or high risk diseases. One of those, they've recently lowered your body mass index, or really kind of how much you weigh, to just over 25. Well, Karen, I would venture to say that everybody on this panel probably has a BMI greater than 25. No offense to anybody, but 25 is pretty skinny. And so as a result, you could qualify if you're sick, and you have to be diagnosed within a certain time frame. So all that's listed, there's a form that the physician fills out and then can fax it over to the infusion center. Don't just show up, but talk to your primary care provider or get in and see somebody, especially if you have a high risk complication. So all that's listed, there's a form that the physician fills out and then can fax it.
Okay, very good. Thank you everyone so much. Thank you panelists. Thank you doctors. Thank you media members for joining us. For the latest information from the city of Lubbock, visit our website, mylubbock.us, visit our social media accounts, and of course, follow your local news. Have a good week, everybody.
Jim, thank you for all your contributions today. I appreciate your time out of your busy schedules. Lynette, thank you.